Hey, my name is Blakely Holyfield, and I'm a student here in the College of Nursing, and today I'll be doing my medication administration checkoff. So if you can scan the room. Here's my ID badge. So first I'm going to verbalize that I'm going to be in a medication room with the door closed, no cell phones. I'm going to limit my conversations with my colleagues to only essential information to the bare minimum, and I'm also going to be in a no interruption zone policy. So first I'm going to do the 7 rights, but I'm also going to compare the order to the MAR. So I see I have Jones Jaguar, date of birth 8/25/1963, date of birth 8/25/1963. The MR number is 417-6352. MR number is 417-6352, room 2040, room 2040. Also see I'll be giving morphine sulfate 5 milligrams IM every 4 hours PRN for pain, and I see Mr. Jones has not been given it within the last 4 hours. However, next I'm going to assess for allergies. So I see Mr. Jones is allergic to penicillin. Now I'm going to perform hand hygiene. So next I'm going to move to the first right, and it is right patient. So I see I have Jones Jaguar, date of birth is 8/25/1963, date of birth 8/25/1963. MR number is 417-6352, 417-6352, room 2040, room 2040. Next I'm going to move to the next right, and it is right medication. So first I see I'm given morphine sulfate, 5 milligrams IM every 4 hours PRN for pain. So today my medication is morphine sulfate. Take this, throw this away. So I have morphine sulfate 10 milligrams per milliliter, and the expiration date is 12/20/2025. Next I'm going to move to the next right, and it is right time. So I see I'm giving morphine sulfate 5 milligrams IM every 4 hours PRN for pain. So today I'll be doing it every 4 hours, and Mr. Jones has not been given it within the last 4 hours. So next I'm going to move to the next right, and it is right route. So I see I'll be giving morphine sulfate 5 milligrams IM every 4 hours PRN for pain. So today I'll be doing it IM, which is intramuscular. So I will be using a 3 milliliter syringe, a 21 gauge needle, and a blunt tip cannula. Next I'm going to move to the right dose. So I see I'm giving morphine sulfate 5 milligrams IM every 4 hours PRN for pain, and it has not been given within the last 4 hours. So today I'll be giving 5 milligrams. Well, my morphine sulfate is 10 milligrams per 1 milliliter. So that means with 5 milligrams is half a milliliter. So at this time, I will get my alcohol pad. I will clean the vial. I will get my 3 milliliter syringe and my blunt tip cannula. So since I'm giving 5 milligrams of morphine sulfate, 5 milligrams, I'll be doing half a milliliter of air. So next, since I've already cleaned the vial, I will be taking my blunt cannula and injecting it into the vial. I'm going to shoot the air in. I will pull back half a mil of morphine sulfate, making sure there's no air bubbles in the vial. Now I'm going to use the scoop method. So as you see, I have half a milliliter of morphine sulfate. So next I'm going to verbalize that I would go see another nurse to make sure I have the right drug, the right amount, and the right dosage, and the right calculations. So it'd be half a mil for 5 milligrams of morphine sulfate. So now I'm going to do my next check. So I see I have morphine sulfate, 5 milligrams IM every 4 hours PRN for pain. I got half a milliliter, 5 milligrams. So now I'll make my label. I will put the patient's name, the medicine, and the dose. The drug and the dose. So I have Jones Jaguar. I have morphine sulfate. And I'm giving 5 milligrams, which is half a mil. So I have Jones Jaguar, morphine sulfate, 5 milligrams. At this time, I will now take my blunt cannula and apply my 21 gauge needle. I'm going to open it up. So now I'm going to do another check to make sure I have the right thing. So I got morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, 5 milligrams, which is half a mil, 5 milligrams, half a mil. IM every 4 hours, PRN for pain. All right? So now I'm going to move to the patient's room. And I'm going to take my syringe, my vial, and my MAR. Knock, knock. Hey, my name's Blakely. I'm a student here in the College of Nursing, and I'm going to perform hand hygiene. So at this time, I will do my third check of accuracy. So I see I have Jones Jaguar, date of birth 8/25/1963, MR number 4176352, room 2040. I'll be giving morphine sulfate, 5 milligrams, morphine sulfate. IM every 4 hours, PRN for pain. It has not been given within the last 4 hours. And I see I have morphine sulfate, 5 milligrams, which is half a mil. So next I'm going to do my 2 identifiers, and I see I have Jones Jaguar, date of birth is 8/25/1963, date of birth 8/25/1963, MR number is 4176352, MR number is 4176352, room 2040, room 2040. I see he's allergic to penicillin. Mr. Jones, is there any other allergies I need to know about today? Okay, perfect. So next I'm going to do a pre-administration test, and I'm going to see his pain levels, blood pressure, heart rate, and respiratory rate, and they all came back normal today. So now I'm going to explain the procedure to the patient. Mr. Jones, today I'll be giving you some pain medicine to lower your pain, and today I'll be giving morphine sulfate. So at this time, I will raise the bed to a working height and lower the side rails. And wash my hands, perform hand hygiene, and I'll apply my gloves and goggles. So today I will be doing the ventrogluteal site, but first I'm going to assess for skin integrity and bruising, and I don't see any of those today. I will also be doing the ventrogluteal site. I'll be doing it at a 90 degrees angles, and I will also be aspirating for blood return. At this time, I will get my alcohol prep pad. And I will clean in a circular motion. And I will leave that right there. So now I will inject this at a 90-degree angle while spreading the skin and aspirating for blood. Aspirate for blood. I don't see any of those. Dispose in the sharps container. Apply pressure. At this time now, I will check for any allergic reactions, and I don't see any of those today. Next, I'm going to reposition the patient for comfort, lower the bed, raise the side rails, and take my gloves off. Glove to glove, skin to skin towards the trash can, and perform hand hygiene. Next, I'm going to document on the MAR that he had morphine sulfate, 5 milligrams IM every 4 hours, PRN for pain. I'm also going to document how Mr. Jones did today. and that he had no allergic reactions. However, within the next 30 minutes, I'm going to reassess the patient to make sure he has no allergic reactions and that he is normal and he is doing very well. At this time, this concludes my medication administration video.